very welcome back to the show. Lower back pain, it is the most common cause of job-related disability, with about 80% of adults experiencing it in their lifetime.
So what causes it, and more importantly, can you treat it? Well, Dr. Dominic Hegarty, consultant in pain management at the Mater Private Hospital here in Cork, is with us again. Dominic, great to have you
with us,
on
Dominic.
the show.
Thank you very much.
Straight into it,
Thank you.
what is lower back pain?
It's a pain that causes a lot of problems for a lot of people, and it can occur very quickly, is the bottom line. The easiest way of kind of classifying it for people is to say, how long have you had it, which is simple. So take, for example, someone who's getting into the car this morning, they wrench their back, they hurt their back muscles. They're going to take 4 to 5 days to get over it, 6 days. It'll be Monday before they'll be feeling back to square one. And
so that's acute pain, is
That's
that
acute
right?
pain. It's an episode, we've all experienced it at some period of time, but it's enough to put you out of work for 2 days and you get back to your feet.
Is that the lower back then, or the muscles around it?
It's the muscles around it a little bit, but it triggers off a whole sequence of events as element to it.
It's kind of your back freezes in one sense, doesn't
freezing,
it?
because that's
Really
what the muscles are
tight
doing. They're spasming up to it. And that brings us to the next phase, which is the 6-week person, the person who doesn't get out of it. They're struggling. They're barely making the physio, able to get a couple of tablets from their GP medication, and they're still struggling. They're not making ground. And, you know, it comes to an end. You're trying to get over it. I mean, 6 weeks from now is Easter. So if you hurt your back this morning, you're actually in trouble by Easter.
It's a long time because you can't walk around properly.
No.
You're limited in what you can do.
Absolutely.
Is that then when you go to the next level, which is chronic pain? That's
Yes.
continuous?
There's continuous. Definition of that is anything that goes beyond 3 months at that point in time. But a typical scenario for someone who's that sequence, if they don't get out in 6 weeks, they are looking at struggling for 6 months at that point in time. That is a long time by the time you get through the whole element. Again, if you use dates, that's nearly August by now. So if you're caught from today, you're going to be in trouble to nearly August.
That's the end of the summer.
That's the end of the summer.
Yeah,
and you've
you're
lost
in
a lot
pain.
of valuable time over the summer season, a lot of good time with the family and work to a point. But it's not to be negative towards it, but it just does drag on. And sometimes it drags on because people don't know what's going on. They leave it behind. They don't understand it. And all I'd say is, look, talk to someone about it and start thinking about it.
You're paying for a long time constantly, though.
Constantly.
It's like it's 24/7.
It is, and it's simple things like being able to play with the kids, being able to walk around at the counter at home, doing the jobs. It's all an issue. Sitting in the car for a length of time.
Are people, though, masking it sometimes with drugs, and that continuity just continues then, but the issue is not being dealt with?
It's a little bit of that, but in fairness, if you're sore, you're going to take oral medication to do it. I think what comes to it is they come to a point when they realise it's not working anymore. And that, I suppose, raises the question, why isn't it working anymore? And you have to look at the structure of the model to try and work the root of the problem.
You're going to show us the different parts. Tell us exactly what we're looking at here first.
This is a nearly life-size model of a lower back disc area, and you can see a couple of features in it itself. The classical one that people go for, if I can point out, is the disc tissue itself, and this red bulgy bit is a classical disc that's slipped. About 20% of people will have that.
So what will they be feeling, somebody who has that?
That individual will pick up pain travelling down the leg into their toe. It's irritating them at night time, and they're basically not able to do an awful lot about it. Some of the questions that came in were related to
there's
this
one on
element.
sciatica there. Is that the type of pain
It's
you'd
the
feel?
type of pain that you'd feel from that element to it itself. So it's classically, it's in the distribution of the sciatic nerve. That's why it gets its name.
Okay, well, that's interesting.
It's just here as well. I just finished off here. It's now travelling to the heel of the foot as well. So it's travelling all the way down. I take painkillers for it and do exercise, try to ease it.
Absolutely, and that's exactly what happens. Now, in that case, when it gets to the heel, I can tell you, even without looking at MRI, that's hitting the lower zone, the L5 territory, much lower down, the commonest area that will catch over here. And it entraps or leans against this yellow nerve that's here. That's what causes the pins and needles. And if people who haven't had sciatica, all you have to do is remember, if you bang your elbow, you get that stinging. Imagine having that all of the time. That's the picture.
That happened to me before. And when I was inside in bed then, Dominic, right, I was trying to sleep. I was getting into a comfortable position. So I was sleeping like this across the bed. But what happened then, I actually put out my shoulder. Because I was compensating for the sciatica.
You were holding your shoulder in a bad
And so
way,
then I had another 4 or 5 months trying to get my shoulder right.
Absolutely.
Because I didn't take care of it at the
Absolutely,
time.
but following through, if we don't mind, that's exactly what happens. And I'm going to just tilt this around. So yeah, you're going to struggle. All the muscles that fit into this gutter that's either side, the paraspinous muscles, they run alongside, they start to struggle just to deal with exactly that scenario. And guess what? The next thing that goes into trouble are the facet joints, these knuckle joints either side of the back itself.
And the longer this goes on, the worse it's going to get.
It just
what do you
adds
do,
on.
though, when something like that happens? Let's go back to the sciatica stage. What do you do?
Simple answer, if someone comes in, the first important thing is the timeline. If it's an urgent element, you may have to be referred to an emergency department to make sure that things are settled down. But let's take it to a situation like 6 months that's going on. An MRI scan is very useful because it rules out where the level might be. My scenario would be, I would look at that, chat to the individual, do a couple of examinations, but ultimately it would involve injections to the area from my perspective. And I can, under X-ray guidance, we can look at the foramen that are opening there. I know the lads have, in the producer's line, have a shot of the lower back with an X-ray up
James,
itself. And while this is focusing in on the facet joint in particular, what you want to do is you want to put your injection into the area where that nerve is going, and
So
essentially numb it.
do to it then, Dominic?
It's a basic combination of local anaesthetic and some steroids, so it takes the swelling off the nerve itself. And you're hoping that would reduce the symptoms by at least 50%, takes the pressure off. They can start going back and walking and getting their exercise regime going down.
Because the exercise is very, very important then as well.
It is very important, really. It's an important aspect to get right, to ensure that the muscles stay nice and strong in some respects, both pre and post the injury itself. There's no point doing the exercises when you're hurt. You need to be doing it all of the time.
Okay, so basically you're saying you go to your GP, you'd eventually maybe end up with someone like you, and then you would slowly help the muscles and repair with the help of drugs or a steroid or whatever.
Yes, absolutely. And that's where the injection work really comes into its own, because it's so focused, it's specifically into it. And that's really where I do my work, is to try and target the area that's giving the information. And that's very reassuring for an individual when they're with you in the theatre complex, you're under X-ray, you're doing it live, you're picking up the spot with them there and then, and they say, hey, that's the spot.
Because you see pain differently, because we spoke about this before. We see pain as pain, but you see pain as you're taking all the layers back, where it's coming from, where it's going to, why is it going in this direction and not another direction.
That's
I just want to get this in, another one in here, and it's a pain around the coccyx. I'm 3 months suffering with that. It's getting worse, especially when I walk. I've taken medication, but it doesn't work. I work in an office, so I sit 90% of the day. Now, is that the problem they're in?
A little bit, but if they've had that situation, that sounds to be like a coccydynia, which is a slightly different, but it can give that lower back pain. Again, if I move this guy a small bit here for us, the coccyx is the tail end bit here, so it doesn't surprise you that
you sit on.
You sit on, absolutely, and we're all meant to sit on it because that's what we do. And there's a little bit of flexibility in the actual coccyx, but the minute that becomes injured, it's like having a sore finger, and you just can't get rid of it. And as you said, you're sitting on it. You're actually at night time. You're almost lying on it at times. The muscles in the area are protecting it, but they're pulling on it. So that's, again, a very simple thing for me to do under X-ray. You're specifically looking at those joints, you're injecting it to it, you're giving it a chance to heal and take it a break, and break it down piece by piece. So it's not uncommon to hear exactly that scenario.
And even those down there, it's going to affect the whole lower back, isn't it?
The whole back, because
Is
they're all
lifestyle,
counter.
has lifestyle an awful lot to play with it, Dominic, these days? I mean, let's, for example, can the people that are watching today, that are sitting in offices or indeed maybe working from home, as a lot of people do now, should you get up and walk around, should you try and help yourself on a local level before your GP or a specialist arrives in?
I think that's good practice and good absolute practice. We get excited about it, we have OT in and we do this and check you've got the right chair, but we all go home and we sit in the chair at home, for starters, in the wrong way. We just throw ourselves there at 5 in the evening. You're very happy to lie down, never mind sit down, which you're right. So we have to be more conscious of it. We're also moving between desks more often a little bit, so you're not always at your own desk, and you're quickly doing jobs, you're in and out of the car more often. There's so many variables. Before, you used to say it's kind of a manual labours issue. The guy who's out doing the work, he has to hurt himself.
Now it's sitting
But
down.
actually it's sitting around. And it
Dominic,
goes down to muscle.
thank you very much.
Thanks so much.
Great to have you as
Sorry,
always.
we've run out of time. Always, as we said, consult your GP if you do have any health concerns.